Hi, I'm Dr. Jeremiah Peck with Ally Academy Northwest, and welcome back to our video series on the NCE or National Counselor Exam. This video is part two of a two-part section on the helping relationship topic that accounts for the majority of the questions as topic areas on the NCE. In part one, we examined several different umbrellas or domains of theoretical orientations. If you haven't watched that video yet, I would encourage you to pause this and go back and watch part one of this section. In this video, we're going to be looking just briefly at the application of these counseling theories, not as individual theories, but the application by way of conceptualization, by way of golden thread and treatment planning as it relates to test questions that you may encounter on the NCE. Another element that's often included in this is the process of documentation as it relates to your treatment planning, documentation including use of evidence-based practices, techniques, interventions that are used with clients in a counseling context, as well as understanding the process and the practice of utilizing clinical consultation. So documentation in clinical counseling is an imperative. And in the documentation process, you are documenting the content and the treatment planning related to the client's presenting problem and their progress towards their goals. Now, we'll talk more about goals in just a moment, but by way of the documentation element, you want to ensure, particularly as you're studying for your national counselor exam, that you're familiar with the elements, the essential elements that are to be included within your documentation. In the scope of today's video, I want to highlight the need to document evidence-based practices as it relates to both your theory, which we discussed in a previous video, as well as the client's presenting problem. And these practices that you are documenting by way of interventions used need to line up with evidence and literature and research as being best practices or being evidence-based in treating the client's specific presenting problem. Another element that you're going to document in this process as you make those clinical decisions is any clinical consultation that you utilized in coming to that conclusion. For those receiving supervision, clinical supervision, this is where you would document in your notes that you discussed this treatment plan with your supervisor, who agreed or gave insight to this being an evidence-based course of action for this specific client. This has to do with what's referred to in counseling and what may be referred to in your NCE exam as the golden thread. The golden thread is this metaphorical line that can be traced from the client's background to their presenting problem, to their diagnosis, to the treatment plan that you have collaboratively formed with them, any ethical, multicultural, or spiritual implications that are impacting the course of therapy and the overall trajectory of the client's desired outcomes. There ought to be a line connecting the rationale, what's referred to as the conceptualization of all of those various elements, so much so that questions may be examining the consistency entailed in the golden thread. Those are some examples, or that's an example of a question you might encounter as it relates to this. For instance, the importance of connecting an evidence-based practice to the client's presenting problem as evidenced by their diagnosis, as it's a symptom of the reason why they're coming in to therapy. Something else you might see as it relates to the golden thread are those ethical, multicultural, or even spiritual considerations as they relate to the client's treatment plan. You may think that in the treatment plan, you're really addressing or utilizing what interventions you're using to treat the diagnosis, but don't forget that this is true for both clinical practice as well as this may show up on your exam, that you're not treating a diagnosis, but rather you are treating a person. And that person has a variety of lived experiences. Your treatment plan then, the plan that you document, needs to incorporate not just their diagnosis, but the person that you're treating by way of their culture, by way of their age, in so much as things that are unique characteristics or identifiers as they relate to the client will be significant as it relates to your overall treatment plan. Think how you would formulate a treatment plan for a client with age diversity, say two clients of different chronological ages, though they have similar diagnoses, you would still likely incorporate elements of their chronological age differently into that same treatment plan. Something that's referred to often, and you may encounter questions about this, is as you're treatment planning, you are also formulating therapeutic goals. These goals, in order to be consistent with best practices, literature suggests that they must be SMART goals. Now, SMART as an acronym stands for specific, measurable, actionable, realistic, and time-bound. You may find some variations on those words, but generally, the goal that you have must fit those 5 parameters. For instance, you wouldn't document in a treatment plan that the goal is for the client to be less anxious. Well, that's not very specific. It's not measurable, and it doesn't really entail things like specific actions or even a time frame. A SMART treatment goal may sound something more like the client will reduce the number of panic attacks experienced, or the client will reduce their scores on a GAD-7 assessment from this numerical value to this numerical value through these specific actions or by these specific practices and interventions, as evidenced by, that's another phrase you're going to see often both in clinical writing as well as potentially on your exam, as evidenced by a specific measurable indicator, and then landing on a time frame within this number of sessions or within this number of months. That's exceedingly important in a treatment plan design as well. Another important piece of both treatment planning and documentation that I want to touch on in this section is the importance of safety planning and facilitating risk assessment. In your documentation by way of application in your treatment plan and goal setting with your client, you're also documenting that you've done a thorough safety assessment or suicide assessment with your client. This is where you've identified any safety considerations or concerns that the client is either presenting or that you have assessed for specifically, and that you are documenting within your paperwork, within the client's progress, that those assessments took place, what the outcome of those assessments are, and any potential follow-ups that you'll have as a result of those assessments as they relate to the client's safety or any suicidality that the client may be presenting as well. This is also where you may document crisis intervention best practices, community-based resources and support that you have recommended to the client or informed the client of. And while all of these interventions are distinct from specific theoretical interventions that we discussed in a previous video, you'll see how there's a relationship between the two. As you are exploring a client's adverse experiences that contribute to their presenting problem, you are also assessing by way of these counseling skills to facilitate a helping relationship that helps the client move towards their desired outcomes. This concludes this two-part section on the helping relationship portion of the NCE, which is part of a greater video series here where we're examining the 8 different content areas that you'll encounter when taking the National Counselor exam. So thank you so much for watching this video, and I will see you on the next video.